On today's episode of Leading Veterinary Teams on Air, I'm joined with Dr. Desmond Coates, a veterinarian and medical director whose career reflects both clinical excellence and a deep commitment to leadership that strengthens and uplifts the teams around him. What makes this conversation especially meaningful is that Dr. Coates doesn't approach change as an abstract idea. He's experienced it personally, led through it professionally, and continues to shape it in tangible ways. His perspective sits at the intersection of medicine, leadership, and belonging, and despite his short tenure in his formal leadership role, he brings clarity to conversations that many veterinary leaders are still learning how to navigate. In this episode, we explore what it truly means to lead with intention, how we create pathways that may not have previously existed, and the responsibility we carry as leaders when shaping culture within our teams. I'm grateful for the depth and honesty of this conversation, and I think you'll walk away with both perspective and practical insight. If you're ready, let's get to it. Welcome to the Leading Veterinary Teams on Air podcast, Dr. Coates. It is really awesome to have you here. For anyone who doesn't know you, can you tell us a little bit about yourself?
Yeah, so my name is Dr. Coates, or Desmond. I'm a practicing veterinarian director based in Cincinnati, Ohio, in one of the suburbs called Mason. I've been in my leadership role for roughly 5 months. Before then, I practiced in Philadelphia, PA for the last 3 years. I graduated from vet school in 2022. My dreams of being a veterinarian happened at the age of sixth grade. And my main inspiration for joining the profession is through my late Uncle Brian. My late Uncle Brian was a military man. He served overseas after he graduated from high school. And he had this profound love for animals. He bred and reared miniature schnauzers and German Shepherd. And just like I would say that he's my inspiration for veterinary medicine, he's also my inspiration for leadership. My Uncle Brian was somebody who believed in mentorship. He mentored me and my younger brother and sister at a young age. He was very engaged in the community, serving as a mentorship figure to kids from his old town in Osceola, Arkansas. And I would say that he had a major benefit on me in my life. Me and my key lessons, I apply myself in my leadership style, I learned from him. Generally speaking, that's what I say is a nutshell about me. Born and raised in Arkansas, but spent the majority of my life in Tennessee.
Okay. So you graduated only a few years ago and jumped into leadership pretty fast.
Mm-hmm.
It sounds like you had a knack for leadership early, right? Having learned that from your uncle. But what made you want to jump into leadership so fast after becoming a veterinarian?
Thank you. One thing I always talk about is that in undergrad, I served as president of my fraternity for 3 years, along with being president of several school organizations. I also serve as a resident assistant at a dorm called Reese Hall at the University of Tennessee for 2 years. I've always had dabbled in leadership and had a distinct interest in it. In vet school, I got the chance to be selected for the Veterinary Leadership Experience, VLE, which is a major leadership type of development course or camp, which you get to interact with vet school students from across the world. I got entrance into leadership concepts early on, and when I became a veterinarian, I still kept that leadership hat on me. So I will often, been the one to mentor my staff, teach them things or make PowerPoint presentation or trainings to address gaps in my hospitals. And I kept the leadership hat on as an associate. After practicing for 3 years, I felt I was ready to take on a leadership role. I applied and I got one, and here I am now.
Yeah, that's really awesome. It sounds like the leadership has followed you. It's one of those things that I actually say a lot for myself too. I've been in a formal or informal leadership position ever since I have been working, even very young as a key holder. The moment I was able to do some kind of leadership thing, people were always looking to me to do whatever it was. So it sounds like whatever your uncle instilled in you very early on has followed you through.
One thing I always tell people is that I view leadership as an act of service. I don't really think that leadership has anything to do with a title, because one thing I learned, as being a associate veterinarian, that by me being a doctor, I'm a leader. I understand that my role within a hospital is to allow people to have a job and to provide relief for my clients and, most importantly, my patients. I have the ability to impact someone else's day by having a good mentality, positive attitude, being willing to mentor and train others. I can help others grow and live to their potential. I understand that if I bring a negative mindset, I can negatively impact someone else's day. I can make somebody's day of work be a little bit harder. And my goals when it comes to veterinary medicine is that I want to be a positive influence. Veterinary medicine's already tough enough as it is. So if I can brighten up my teammates' day by being positive, making them crack a smile, then I'm doing my job.
Is there something about leadership when you were leading in college through your fraternity or in the last few months as a medical director that has surprised you in your leadership roles?
Great question. I think the thing that surprises me the most when it comes to being a leadership role is how much mentorship people actually need. I've learned that, in early goings, and especially my fraternity, when I have, welcoming new brothers, how much mentorship they needed. Everybody has their own unique story and background, and sometimes we take for granted the background that we have. I am incredibly grateful for Mark O'Brien having that strong male role model in my life. One thing I understood, especially in my fraternity, is that some of my younger brothers in the organization didn't necessarily have that strong paternal figure in their life. I learned through being an associate veterinarian like how underdeveloped some people are. Sometimes people don't know what they don't know until somebody's willing to bridge that gap to them. So, to simply put, the things that surprises me is like how much impulse influence I can have on people's life just by being willing to sit down and teach them and just being willing to listen to their perspective.
Yeah. And how do you deal with that, right? There's days, I'm sure, that you go to work and it's not, I mean, you said it yourself, veterinary medicine is not easy, right? So, how do you go into work and have people that are in a different place in their lives and are coming to you and do you sit there and get frustrated and say, like, how do you not know this already? How do you internalize that or externalize that, if you will?
I know for me, my background in veterinary medicine, after I graduated from college back in 2000, how long has it been? 16. I got me a job as a veterinary assistant, and I understand that my first job, I didn't know everything. And I would say that, in the culture in that time, that people weren't necessarily as patient with me. So what I lean into is I think about my own beginning. I thought think to myself like how I first started. I wish the people I worked with had more patience for me and really to help bridge my gaps, help me develop. So when it came to me being in the other side of things, I decided I wanted to be better than the leaders that were to me when I first started. So my thought process is like this: I can't judge somebody for not knowing something, especially if this is their first job in veterinary medicine or they weren't taught explicitly. So instead of me judging that person for what they don't know, I can be the person that can teach them so they can know how to be better.
What would you say to somebody who is a leader for the first time? Maybe they're really well intentioned, but they don't have the same background as you. They don't come from having been on the floor, having that experience, and they don't know how to build that trust with the team in that way. I imagine that having that experience builds trust with them. What would you say to somebody who is walking into the team and trying to build trust with them, but doesn't really get it?
I would tell that young leader to keep the course. One thing I would tell new leaders is that self reflection is essential to leadership. You have to be willing to look back at yourself and say, okay, when I was saying this or explaining this, did it land quite well? And that maybe you have to start paying attention to how people's body language are. Were they leaned in, being attentive, or did it seem withdrawn? Also, I told to a new leader is have your network. One thing I can say about field of leadership, I believe a misconception is that leadership is lonely. I don't think leadership has to be lonely. It's about having those mentors around you, reaching out, making your connect work of your community, of leaders and just asking for insights. If you have a strong network of leaders, it's rarely something they haven't seen before. Most importantly, being willing to invest in your own education. Thing is with leadership, and which that a lot more leaders do, is being willing to read, reflect, and trying to fill in their own gaps through reflection, really. Because there's plenty of resources that leaders have to improve their leadership. It's just taking the time to develop those instincts and being willing to self reflect, and most importantly, asking for feedback of your team. One of the most powerful things that a leader can do, especially a new leader, is follow through. Be consistent in what you're saying, what you're doing. Because one thing I've learned through my time is that people don't expect leaders to be perfect, but what they want leaders to be is accountable.
Yeah. I was actually going to mention that because you write a lot about accountability, you write about psychological safety and living side by side with your team. I'm really intrigued by some of the stuff that I see you writing, but I also saw a post you posted with a whole bunch of books. I was like, oh man, this is a guy that reads a lot. I have a huge stack of books in my home. So I was like, we have a lot to talk about. I am really intrigued by this idea of accountability. How do we hold people accountable while also making them feel safe? How do you hold that line as a medical director? Because you want them to feel like they can come to you and talk to you, but you also have to hold them accountable for the job they have to do.
Mm-hmm. Great question. It's a balancing act. One of the biggest books that I've read that's been helpful for me has been Crucial Conversations and subsequently Crucial Accountability and Never Split the Difference, along with Stories That Stick. One thing I can tell from those four books is that, especially Crucial Conversation, Crucial Accountability, is firstly entering these conversations with a calm state of mind. I think that what happens is that too many leaders have these difficult conversations while they're angry, while they're upset, while their emotions are fluctuating. And one thing I would say is that it's good to take a breath, be calm, and master what these books says as your stories, really. The purpose of a conversation isn't to be right. The point of a
Yeah.
conversation is to provide clarity. So my focus when I'm having these difficult conversations with team members is what is the main purpose of the conversation? If the purpose is to mitigate a potential safety hazard, I need to focus on that. And one skills and tips that I use is one, saying the quiet thing out and open. Too many leaders beat around the bush or are afraid to say what they're talking about, which in turn makes the person you're talking to more nervous and anxious because they're not sure what you're getting at.
Yeah.
So by mentioning what you want to talk about directly, it brings the tension down a little bit. Another tip that I use is ask them questions. I tend to rely on asking how or what because it's always good to invite the other person's perspective. That way they can give you insights that if you go in hot, you may never get. People are complicated and simple at the same time. Oftentimes, it's something more beneath the surface. And
Yeah.
by inviting perspective, it can allow you to effectively coach that individual. Because it could be that it was a one off, or it could be other factors that led into their day, the situation you need to coach them on. But of course, if you don't ask those questions, lean into curiosity and again discomfort a little bit, you won't get those insights. You end up coming in with your own expectations, and sure, you may have got your point across, but is it really worth it in which you lose a relationship? You can be right, but if that person ends up leaving because they didn't feel safe, was it really worth it?
Yeah. A few things come up for me. I just recently read a book by Jefferson Fisher, and he writes that you're never trying to win an argument, right? You are trying to have a conversation. So you saying that immediately made me, I smiled because it was immediately my thought was like, yeah, you're absolutely right. You're going in trying to win an argument, then you're immediately on the wrong side of this conversation. And then the other thing you said was to lean into the uncomfort. My immediate thought was to ask you how you do that. It's something I'm always challenging my leaders. I oversee hospital managers to lean into discomfort. They're always asking me, well, how do I do that? My question to you is, how do you do that?
Great question. It's kind of an instinct, but when I say lean into discomfort, be willing to dive into somebody's thought process. Because I have had some times which I had talked to somebody and the same thing happened again. So I'm like, okay. So I had to look, one, do some self-reflection and knowledge. Okay, did I went deep enough, or did I stop at the surface? If a problem happens again and you already coached somebody on it, you weren't having the right conversation. At that point, I had to get into your thought process. What did you see? What is going through your thought process when you're doing this set action? Do you see it yourself? Is it something that's just instinctual? Is it something you recognize? Is this more situational? If I say lean into discomfort, it's more so diving into the situation of somebody's thought process until you get a good understanding of why they move and why they think the way they do. The reason why that could be discomforting because you have to be willing to let go of your own prior conceived judgments or notions of what they're doing and be
Yeah.
willing to explore a new pathway. You don't necessarily know where you're going with this pathway. That's why it could be discomforting. Some leaders may be so scared that we're heading into a direction that I'm not sure how to really approach. Because
Yeah.
sometimes I went into a conversation thinking it's going to be like this and end up being the exact opposite or nothing I expected in the first place. Does that
Yeah.
make sense?
Do you find that having some phrases or things almost to in your repertoire to have as backup? So if somebody says something and you don't actually know what to say, do you have little phrases you pull out as a doctor that will allow you to give pause, even just to give you a second to regroup, to have the next question? I ask that because for me, when I was a technician, if somebody would say something that would throw me off, I always had these few little sentences or these things that I would say that would give me pause to then be able to regroup and go back to whatever it was that I needed to get done. And then I learned over time in leadership, same thing. It took some time, but I would learn, somebody would come at me with something that I was like, what did they just say? I had to learn over time the few little things that I would go back to. Do you have some of those?
I think the one primary one that comes to my mind is, what do you mean by that?
Yeah. It gives you a buffer. They'll keep talking, and then you're like, what is going on here?
Yeah,
Right.
so let's dive deeper into that. What do you mean by that?
Need more.
Tell me more.
Yeah. I love that. I was an oncology technician when I was clinical, and I've had some doozies. Please tell me more. You don't want to come across like you're judging them. Tell me more.
Tell me more. Let's dive deeper into it.
I love that. It's almost having to get past your own ego, right? To be, because I think that a lot of times we tell our own selves stories about whatever's going on with people. And oftentimes those stories are not real. They're just whatever we believe is happening. When you're getting curious about what's actually happening to the other person, it allows that wall that we've put up to get broken down and allows them to tell us their side of the story and opens up this whole new world of reality, whether it's in a clinical setting or in leadership, in our families or in our clinics or in your fraternity. It allows us to see the other side of what's going on. I think that it allows us to take our ego out of it. Have you had any situations where you've made mistakes, where you had well intention to ask some questions, but maybe that question didn't land well, or that whatever your intent was didn't end as well as you had hoped?
Yeah, that's definitely happened before. I remember one time it was a particularly stressful day. I made a gesture to one of my team members, which is said, hurry up. I saw her, their shoulders like dropped and eyes walled up. I was like, oh no, I gotta go fix this. It can definitely happen to the best of us. One thing about being a leader is that you make mistakes. It's impossible to read everybody's body language, even if you do have the best well intentions. What happens is that if you see that somebody didn't take what you said well, is being letting go of that ego and be willing to repair the relationship. 'Cause in that situation, I saw her or I saw them, and I was like, okay, I need to talk to them as soon as they're available so we can hash things out. When it comes to hashing out, I let them talk, apologize for the impact of my actions, and I said, I apologize. This is what I would like for happen next time so we can try to avoid this happening again, and I'll be better. Because
Yeah.
that's why I said the accountability part, because leaders are human just like anybody else. The problems that leaders get is that they don't accept accountability because they're trying to protect their image. At that point, your team won't be able to trust you. What your team don't expect for your leaders to be perfect, but they do expect for your leaders to be accountable. Because if your leader can admit mistakes, they can apologize to you. That builds trust even faster. Because that means that they know that if you do have a misstep, that you're willing to come back around them and to make amends.
You're leading currently as a medical director where a lot of veterinarians are still figuring out who they are clinically, right?
Mm.
You graduated vet school a few years ago, and there are some advantages and potentially some disadvantages of leading in a medical director capacity so early. What do you think early career leaders bring that more seasoned leaders sometimes miss?
So one advantage of being a early career leader is one, you don't bring as much baggage. Because you're a new leader, a lot of times if you're a young veterinarian who tried to take up a leadership position is because you want to challenge yourself and grow. You're more inclined to ask for feedback, ask for help, try to get opinions from different leaders and within a network so you can strengthen your leadership. Of course, being a young leader means you're prone to make mistakes as well. But if you're one that wanted to grow, willing to, be a sit in discomfort, it's not too discomforting to receive that feedback. I think that a lot more younger people, young veterinarians should strive to go into leadership because I think that they have the personality for it. From my experience, leadership is not necessarily about the amount of tenure you have as a veterinarian. It's about your character. It's about, are you willing to sit in discomfort? Are you willing to pay the price that courage takes? Are you willing to listen to feedback from the people above you and from your own team so you can improve your own leadership approach? Are you willing to continue to challenge yourself so you continue to grow as an individual doctor? Of course, some of the drawbacks is that it can be that, you're having to learn how to do multiple different hats at one time. And depending on how you're training and depending on your confidence as a veterinarian, that can, get away from developing you like continue to grow as a doctor. So it's about being willing to know yourself and have balance so you're not overloading yourself or burning out.
How do you keep yourself learning both leadership and as a doctor without burning yourself out trying to be good at everything? And at the same time, how do you combat those who I'm sure exist that are maybe thinking, who is this person who is leading me, that maybe I've been a veterinarian for 40 something years? Have you experienced those people? How do you try to learn all the things without burning out while also trying to lead other people? How do you do all of that?
That's a great question. For me, I view leadership in the same breath as being a doctor. My job is to diagnose, medical condition within our pets and dogs and cats. I'm supposed to be able to ask those questions from the owners, trying to explore all possible avenues to get to the why, what's going on. In regards to leadership, it's a similar concept, but more related to human behavior. Understanding of like when you have an incident that happened between two team members, understanding both sides, seeing like what happened, what led up to this point. Has this happened before? And really trying to understand the root cause. So for me, leadership as being a doctor and leader, I integrate them both, and it's very similar, at least in my mind.
Yeah.
But to be able to separate them as most medical directors, you have to be willing to compartmentalize. One thing I know that while I'm in appointments, I focus on appointments while I can. Of course, there are always going to be things in leadership that happens that requires your attention, that requires you to be able to multitask. But while I can, when I'm in appointments, I focus on my exam, my findings, and making good recommendations and still following those cases so I can see that my outcomes are positive. While I have that time to have the leadership brain, I think purely in my leadership brain, thinking more strategy, how to best solve these issues, making sure like trying to delegate, because that's another important thing for a young leader to know and understand. Leadership is about empowering your team to do more and delegating, because as a leader, I know that I can't be everywhere at once. So I prioritize which things do I need to do and which things can I hand off to another person. And I empower my team to take on a little bit more, make sure I gave them the frameworks and train so they can do these tasks. But it's about me being empowering them to do more. That way I can focus on the things that only I can do. So very similar aspect that as me as a social, I understand that doctors should only be doing like 4 things in a hospital. As a leader, I understand I only have so much capacity and time, so I need to prioritize my time to the issues that the hospitals need me to focus on fixing because nobody else can fix these problems.
You are ahead of your time, Dr. Coates. You are also speaking to someone who is a big advocate for technician utilization. Even though you didn't say technician utilization, you are speaking that language in speaking to delegation. You said doctors can only do 4 things and leaders only have so much capacity, and that is all circled around utilizing your people. Even though you didn't use those words, it sounds to me like you are someone who does look to your team to make sure they are doing the things they have the capacity to do so that you can have the capacity you have, right?
Yes.
And what I hear from what you're saying is just that, right? You are giving your technicians and your team, empowering them to do what they're trained to do so that you can do what you're trained to do so that everyone can work within the bounds of what they can so that nobody gets burnt out.
I'm a big advocate for technician utilization. I tell my technicians who work underneath me that you guys are leading the hospital, leaders on the floor. I expect you to help drive the hospital forward. I try to give them empowerment to make decisions, to be able to delegate, help lead the hospital initiatives. I lean to them all the time because technicians for me are, they're medically trained professionals. They're leaders. And I treat them as such, as professionals. I trust their guidance. I trust their ability to teach, and I want them to utilize their license to the full degree. If it's something I can have you do, so I don't have to do it, I want you to do it because that's what makes them happy. I understand that technician burnout is so high. They're so unutilized. People just use them to do tasks when they could be doing much more. They could be training your team how to get blood. They could be, training your team how to diagnose symptoms of shock. They could be leading some recheck appointments. They could be collaborating with doctors to provide excellent client care. They could be leading client education fronts. Technicians have such a valuable role in veterinary medicine, and I feel that us as a profession are only utilizing them, and this is driving to the dissatisfaction with the degree they work so hard for.
What do you think needs to change in veterinary medicine for it to be sustainable? You just made the bold statement that technicians are burning out, doctors are burning out. It sounds to me like you're empowering your team. It sounds like you are finding time for all the things without burning yourself out. How do people do that? What needs to change for that to happen, not just in your clinic, but elsewhere?
One thing me and my wife talk about all the time is, if you want my answer, which may be a hot topic, is leaders need to stop avoiding. I know it sounds like a simple answer, but it's
No, it's true. I like
leaders
it.
need to stop avoiding. The truth is, I feel so like a lot of problems in veterinary medicine revolves around avoidance. And it's because when you look at us as a profession, you have a group of compassionate individuals who gear towards introversion and who gears to being introverted. What ends up happening is that a lot of practices, it's not the voice that makes the most sense that dictates, the voice of the direction of practice. It's the loudest voice. In some cases, the loudest voice, their solutions aren't real solutions. They're just complaining, and the hospital can't move forward. So when it comes to leaders, leaders have to be willing to have those difficult conversations, make those tough decisions, give that difficult feedback to push the hospital forward. Because what happens on a lot of veterinarian teams is that the team themselves lose faith in their leadership. Leaders feel as though the team feels like it's no point in me saying the things I'm seeing because leadership isn't going to do anything about it. They feel as though their voice doesn't matter and have a sense of learned helplessness, cynicism, really. And that is a spiral towards burnout, going through the same type of problems year after years and years again because the core issues aren't being addressed. So I feel as though for a lot of practices and training the management team, being willing to have those difficult conversations early and efficiently is the best way to help keep the culture going. Once your culture declines, it's hard to bring it back because if you don't have those conversations, small problems turn to big problems. These big problems then turn to people leaving. And now you have to spend all this time, energy, and effort replacing the staff that you do have, only for more staff to leave year after year because the same problems are still there. So my answer is leaders need to start having these difficult conversations because it's not getting better.
Yeah. And would you agree that once you lean in and start having the conversations, you can't just stop?
Exactly. You can't just stop.
Because we fixed it.
No, it's never that simple. The only way for it to be that simple is to see it early, have the conversation early, and address it then. If you're a leader and you allow the issue to grow till it's like, an 8, a 9, 10 on the scale, a 7, 8 on the scale, you're going to have that conversation to correct the behavior. And now you have to have subsequent conversations to make sure the behavior doesn't revert because you allowed it to get so bad in the first place. So you
Yeah.
end up creating a lot more work for yourself versus having it early.
Yeah. You're speaking my language. It is absolutely something that I talk about a lot. And it feels like for people like you and me, something that is obvious, but like what you said early on in this conversation, it's not as obvious, right? People need mentorship. People don't know these things. It's important that we continue to have these conversations and share that information. It's wild to me how many people I come across. I imagine you feel the same way. Have never heard these concepts. And I'm like, really? It's crazy. How much does mentorship come into your life?
I have several mentors that I collected over the years, and they're all leaders, private practice owners, executives in corporations, also fellow medical correctors. And when it comes to mentorship, it's so important because I don't know everything. Sometimes it's good to have somebody to talk to balance your own thinking. As leaders, especially you haven't had the conversation yet, we make these stories on my mind that is like this, that. And sometimes we need that mentor figure to be like, yeah, how you consider this though?
Yeah.
And there's been times which my mentor brought up a good suggestion, like, I didn't consider that. And when I have the conversation, the things that they were saying was true. But it's also good just to have that person to calm down your own thinking because sometimes it's hard for us to bring it to a simmer. So having
Yeah.
that mentorship in your life allows for you to get a different perspective, go into that conversation calmer with a potential that is not what you're thinking. I always
Yeah.
hope to myself that when I'm thinking in my head is not the case. I always hope that I'm wrong because I always believe that with assumed positive intent that it's always a misunderstanding, which 9 times out of 10 it usually is. It's a
Yeah.
misunderstanding or a extenuating circumstances or a one-off versus somebody's actually doing these things to hurt your feelings.
I try to remember that most people don't wake up in the morning thinking that they are actively going to hurt me. I
Exactly.
generally don't wake up thinking about other people in that way. I really like to hope that people are not thinking about me in that way. If they are, then that's really a them problem and less of a me problem.
Yeah.
And that's at least what I try to think about during my day to try to keep me calm. I always like to ask people what is one book that if you had to recommend every single person that is watching or listening to this had to read, Pick one.
The book that I read will be Crucial Conversations. I feel the secret to life, especially in leadership, is communicating.
Yeah.
And I feel so some of the strongest leaders I met are also strong communicators. And I also feel as though some of the most happiest people I met are people who know how to communicate to other human beings. So I would say that if anybody is looking to boost their career, learning how to communicate Crucial Conversations offer key insights to that. Because I learned that by me being a good communicator, I'm able to get my messaging across to the team, able to connect true stories, the lessons that won't stick otherwise if I was a poor communicator. So yeah, and answer your question is Crucial Conversation. My number one book I would recommend.
Is there any advice that you would have for somebody who is looking to go into a leadership role?
Sure. The biggest key advice I would go to anybody looking to go into a leadership role is make sure that you're joining or wanting to be a leader for the right reasons. And for me, the right reasons is that you care about people. You want, people to grow, have a good time at work, and you want to make things better. Leadership should never be a position that you take because you want the power, or a position that you take because you want to be in control. Otherwise, you'll be an ineffective leader because you'll focus on optics and control versus making things better for your team. If you're interested in taking a leadership role, understand that it is a bit of weight to it. If you're wanting to make the lives of your team members, clients, and patients better, then go forth with it. And the knowledge that you're not going to be perfect and you're going to have some make mistakes along the way, but look at it as a journey, and look at it as it means you challenge yourself to grow as a person. And you have a group of individuals who are going to keep you honest to make sure that you are growing as a great leader. So, yeah.
Is there anything we haven't talked about that you want to share before we go?
I would say the thing that's on my heart is I look forward to being a leader, leaning into discomfort, leaning into curiosity, being willing to have those tough conversations. That way you can save yourself a headache in the future.
If anyone wants to connect with you, how can they connect?
They can connect with me on LinkedIn. I'm generally pretty good about trying to respond. I would like to be able to connect with more of my followers and more people who follow you. Thank you, Suzanne, for welcoming on your show.
I will put your LinkedIn information in the show notes. Dr. Coates, thank you so much. It was a pleasure getting to know you and chatting with you today. I look forward to all of the wonderful things that you are doing and going to do. I think you are still very early in your veterinary leadership and professional life. We're going to see a whole lot from you, and I'm excited. So
thank you. I appreciate that high words of praise. And I appreciate all the things that you're doing in your network. Definitely enjoy your contact and hope you keep forth with this podcast. It's great to have these conversations.
Thank you so much.
Yeah. Have a good one.